Hi, I'm Dr. Bryan DiMarco at Renew Dental. We get a lot of questions about dental fillings, so I'm here today to answer a few of these questions and hopefully give you a better understanding of what a dental filling is. First off, what is a dental filling? So, a dental filling is when we have an issue in the tooth. So, usually it's going to be we have a cavity, which is bacteria growing in the teeth, or we have a crack or a break in the tooth that needs to be repaired. What a filling is basically we remove all of that unhealthy tooth structure and we place a material in the tooth that allows it to be the similar shape as the tooth before the issue occurred and allows you to continue to chew on it afterwards. So patients will often ask if fillings can be avoided. Yes, they most certainly can. So the main ways that you can prevent the need for dental filling, first off, would be having good oral hygiene. If we have great oral hygiene, then we're going to reduce our risk of getting a dental cavity. The other thing would be looking at getting preventative treatments done. So for example, in a patient who grinds, we want to get them a night guard so that we can protect their teeth and reduce the risk of it breaking in the future and needing a filling. So what are the different types of fillings in dentistry? So dental filling materials, there's two main ones that are used for fillings. The first one is the tooth colored filling material, which is a composite resin material. And then the second is the silver fillings, which is called amalgam. So at our office, the vast majority of the fillings that we do are the tooth colored composite resin fillings. The main reasons that I prefer this material is that it looks more aesthetic. So we can usually match it pretty close to your tooth. So it's hard to tell that you have the filling. The second reason is that it allows me to be more conservative when I do your fillings, which means I don't have to remove as much tooth structure, which can weaken the tooth over time. And then the last big reason is that the composite fillings are not as hard as the silver fillings. A lot of the time with the silver fillings, we see cracks that form in the teeth, and those can be very difficult to treat and lead us into needing to do a crown. So that's why I prefer the composite resin material. The other types of fillings that are out there, so there are some temporary fillings that we do sometimes do, and then there are some gold fillings that used to be done in the past but aren't as common anymore. So patients are often concerned if their dental filling can match their tooth color. The short answer is yes. So with the composite resin materials, we have a vast array of different colors that we can choose from, and we do our best to try to match it as best as possible. Especially for the front teeth, we take great care in matching it and making sure that it looks as good as possible. So patients will often ask, will my dental filling procedure hurt? At our office, we do everything we can to try to make it as painless as possible. This really starts with giving a good injection because we do need to make the tooth numb so that you're comfortable during the procedure. We will do everything we can to make that injection as comfortable as possible, from using topical anesthetics so your gums are numb before the injection goes in, injecting slowly so that it's as comfortable as it can be, and then also making sure that you're fully numb so that when we start working, we don't have you have pain. So after getting a tooth filling done, patients will ask, can they go ahead and start brushing and flossing their teeth? Yes, for the permanent fillings, it's not an issue for you to go ahead and start brushing and flossing right away. Patients will ask, now that I have a dental filling, does it eventually need to be replaced? And the short answer is yes. So if you look at clinical studies, on average, fillings will last about 6 to 7 years. Usually the main reason a filling is going to fail is we develop a new cavity around it. So the best thing to help prolong the life of your fillings would be having good oral hygiene so that we can prevent these cavities from occurring. So for the cost of a tooth filling, that does vary depending on which tooth the filling is done on and then how large the filling is. As a general rule of thumb, though, usually anywhere from about $200 to $300 is typical. But whenever we diagnose a filling at our office, we will give you an estimate and to make sure that you are comfortable with receiving. So if you do think that you may need a filling, we definitely recommend scheduling an appointment as soon as possible. One of the main reasons that fillings need to be done is a cavity in the tooth, which is bacteria growing in the tooth. And the issue is the longer we wait, the more that bacteria typically tends to grow. So we always kind of say nothing in the mouth gets better by waiting. So it's always better if we can treat it sooner than later. The other side benefit of it is if we can get away with just doing a dental filling if the cavity is small, and we can avoid a procedure, say, such as a root canal, it is going to be a lot less expensive for you as a patient. So I hope I was able to answer a few questions about dental fillings today. If you do have any further questions, or you think you might need a filling and would like to schedule an appointment, please give us a call at 204-259-3804.